This is Dr. Jiu-Jitsu, your go-to podcast for combat sports, military performance, injury prevention, and treatment. Now here's your badass host, Dr. Megan Jimenez.
Bow to your sensei!
I'm here with Dr. Pomerantz, Lucius. He is a black belt in Jiu-Jitsu and orthopedic surgeon like myself. So we both enjoy hurting ourselves and then going to work and treating people that hurt themselves. He's also certified in lifestyle medicine, which we're going to talk about a little bit as the interview goes. He is a hand surgeon specializing in the upper extremity. And we're going to talk a little bit about why doctors get pulled into orthopedics in particular, or why doctors get pulled into jiu-jitsu in particular, why other doctors of surgeons, everybody gets pulled into this sport when it's so injury prone.
Yeah.
So thanks for coming on.
Thanks for having me. It was great.
Yeah. Okay, so why don't you talk a little bit about what pulled you into orthopedics and what pulled you into combat sports?
Sure. You know, the parallel tracks and, in the world of orthopedic surgery, it's a lot of the jocks, the people who end up going to medicine but played sports growing up. That tends to be the trend towards orthopedic surgery. And I was definitely that kid growing up playing sports. I never had the catastrophic injury, which is usually the catalyst of when a kid has a surgery and then they learn about orthopedic surgery and then that's what they do. I didn't have that, but I think that's kind of part of what pulled me into it. Sports medicine, maybe, that kind of intrigued me. But it was funny, as I was going through medical school, which took me a while to decide that I actually wanted to do medical school, but decided, and I thought I was going to do emergency medicine. I was sure of it. And everyone's like, no, you're going to be an orthopedic surgeon. I'm like, I don't even know what that is. You're not going to fit me into that peg or that hole. Like, I don't know what that is. I'm not going to be a surgeon. They're assholes. And then I did my first rotation of orthopedic surgery and realized, yeah.
I'm an asshole.
And, yes. And putting things together, with your hands, you got tools, you got drills, you got hammers, you got screws, you got the ability to give someone the chance to go back to the things they really like doing. Me being an athlete, seeing other people wanting to do things like that, and I can do that for them, that's awesome.
Yeah. It's funny you say that about like emergency medicine and not wanting to go into orthopedics. I did the same thing. I thought I was going to be emergency medicine or family medicine, then do a sports medicine, like 1 year fellowship, but then not operate, right? And be a non-op sports doc. But once I got into the operating room, I was like, damn it.
Yeah.
Because it's a competitive field and it's a lot of years and then you're a surgeon and now it's still a lot of hours and it's
not
grind.
easy. It's not easy. It's a lot of work. There's a lot of responsibility that goes along with it. But there's so few things in medicine where you get the chance to do something and see pretty immediate results. I'm sure the little lady with the broken hip, you fix it, they're walking the next day. That is incredible. And there's those opportunities that you get in orthopedic surgery that really isn't anywhere else. And, life and death is not a big thing in orthopedic surgery. It's function and all that kind of stuff. And so you're not having to deal with the sickest of the sick and dealing with those things, which is also nice.
Depending on which one you go into. Like your
True.
hand and I'm a sports surgeon. So
Yes.
we have it's stress too, because it's trauma. I always joke trauma, like you can't really make them worse, right? People come in, they've been run over by a train or they've
Right.
been, or in the army, something's blown up or they've been shot and you're like, okay, I can most likely make you better. But in sports and hand, they were already at a very top level a lot of times. If you're doing hand for combat and you have to get them back there. So it's pretty stressful.
Sure. It's definitely stressful. And I think a lot of us are maybe not perfectionists, but we expect a lot of ourselves. And we expect to be able to get patients to a very high level. And when that doesn't happen, it's hard. That weighs on, I think, all of us. And so, those trauma situations were like, I didn't shoot the guy in the arm, but I'm going to put it back together. Right. Yeah, there's a little less stress, but at the same time, you want to do as good a job as you can. But yeah, then there's the treating athlete who, performing at an incredibly high level, tears their ACL.
Yeah.
The special forces soldier, the government has put a lot of money and time and investment in getting them to be elite, and you got to get them back out there. And so there's that stress.
And they're young, and they were already at a very high level, or like a multi-leg. That's one of the worst to me because the percentage of return is so low, especially back to that level. I mean,
Right.
So many injuries it's not perfect.
No.
Like 70%, 80% return. And if you're in that other like quarter. It's really hard to see.
It is. And yeah, there is a failure rate. You can be the best surgeon in the world. It's not 100%. You're going to have failure rates, and it's hard.
Yeah.
And
all right, so why combat sports when you're a doctor and protecting your hands?
Right. So combat sports is kind of interesting. Being into sports growing up, I was a very late bloomer. We were kind of talking about this a little bit. I was really small, but I had some athletic ability. But as people started growing in high school, and I was way smaller than people, it just got really hard. Couldn't play football. I was getting smashed. Soccer, people were just faster, stronger than me. But then there was wrestling with weight classes. I'm like, oh, okay. Even then, I didn't fit the lowest weight class in high school until I was a junior, really.
Okay.
I was really small. I didn't have to cut weight until junior year.
What was like 105, the lowest?
The lowest, yeah, 103. And then at the end of the season, there'd be an allowance for a couple pounds by the end of the year. And so, but yeah, 103, 105. And I broke 100 pounds as a sophomore. Standing on the scale. Oh yeah, I was eating a banana, still wearing my warm-ups, and I broke triple digits. I could see triple digits on the scale. Hilarious. That was a landmark for me. But yeah, weight classes, and so wrestling. And I was okay at it. I enjoyed it. There was something fun about trying to beat somebody. And it wasn't out of violence. It wasn't wanting to hurt someone at all. It was just this, I think, a primal satisfaction of figuring out where you are in this hierarchy of athletics that is very direct. There's no hiding. It's you and another person. There's no balls. There's no other equipment. It's just you and another person, and the best person wins. And there's just something that I liked about it. Then the next leap for me was being very fortunate growing up in Santa Cruz, high-level Brazilian Jiu Jitsu black belt from Brazil. Claudio França ends up in Santa Cruz. My wrestling coach, Garth Taylor, starts doing it. And towards the end of high school, he's like, hey man, you should try out jiu-jitsu. Okay. Yeah. Let's try it out. And that turned into me doing jiu-jitsu. And at the time then in the early 2000s, the Venn diagram of jiu-jitsu guys and MMA guys was a lot of overlap. And so
did MMA.
Start making friends with the guys who are doing MMA, and they're like, hey, we'll get you in a fight. Okay. I'll do that, sure. Try it out. And I guess a common theme through all of this was just wanting to see if I had it. There's a lot of people, oh, well, I could do that if, I wanted to see if I could. And well, I did it. And maybe I wasn't the best in the world, but I did it. I was out there, I tested myself, I trained hard, I've learned more about myself along the way, my limitations, my strengths. And all in all, it was a rewarding experience. I'm very glad I did combat sports while doing all this. And
you were fighting during residency.
I did my second and last MMA fight as a resident.
So how was that? How was the dynamic with your attendings, with your co-residents?
Yeah, it was, so the world of orthopedics, one of the reasons kind of why I knew it was for me was a lot of other doctors, if you're on a rotation on pediatrics or something, the attending would be horrified to hear that I was fighting people. Whereas in orthopedics, they'd be like, oh, okay, just be careful of your hands, that kind of thing. And it's like, all right, I vibe well with these people. And I kind of joke that I got into residency because I did this sort of stuff. The chief resident at the time had me and one of the other medical students on the sub-internship have a wrestling match on the front line of the medical school cafeteria.
That's probably illegal now.
Probably, it was even back then, probably not the correct thing to do, but in 2007, but I got the better of them, and I got decent board scores, and
you got a spot.
I got a spot in residency. And so people kind of knew that was a thing I did. They weren't surprised. But again, it was like, hey, be careful of your hands. And as long as you're doing what we expect you to do during residency, like, hey, do it. I always wanted to get a third fight in, but I couldn't. I got sick. I ended up in the hospital.
Oh.
And that was the combination of residency. The hours were just getting to be crazy. I was cutting weight and just the stress of everything. and got an infection, staph infection on my face, ended up hospitalized. And what was interesting is my white count, when they measure my labs, usually a young, healthy person would be high, elevated when you've got an infection. I was neutropenic, I was low, and so they worried I had cancer or whatever, but it's like, no.
So your immune system just...
So I just, between not eating, not sleeping, and training a lot.
Essentially working 2 jobs.
Pretty much.
Like 2 full-time jobs, if not more than full-time in resident.
I was working out certainly twice a day and working out more than I was sleeping. And when you're young, you think you can handle it, but...
the crazy part is you probably can, but then you kind of pay for it as the time goes on, I think.
To a point. And you find your limitations. During residency, there's the work hours stuff, like limit you to 80 hours a week or whatever it is these days. And as a resident, you're like, they should limit us. And there should be some sort of limit, I guess. You could easily abuse these young doctors. But you also need to find out what you can do. Mm-hmm. And when you're out in the real world, and you're going to be in even more adverse conditions at times, sleep deprived, overworked, tired. You got to know that you can do it.
Yeah.
That you can still do what you need to do. And during residence, you've got a safety net, usually, hopefully. But you got to be able to do things when you're tired and not at your best.
Yeah. All right, let's switch gears a little bit to what you do as a surgeon. What kinds of hand injuries, upper extremity injuries are you mostly seeing in combat athletes?
The combat athletes with hand and wrist injuries, metacarpal fractures. Yeah. The boxer's fracture is by far kind of the most common thing. Fortunately, most of those don't require surgery. But sometimes people break more than one bone, or they break into a place where, that's not ideal. And often, the guys in the middle of a fight will break their hand, and they keep punching with that hand, and what might not have been that bad of a fracture turns into an open fracture, or just rotates it or displaces it. And so metacarpal fractures are definitely probably the most common thing. Jiu-Jitsu, hard on the fingers, and especially in the gi. And so fingers getting twisted, and sometimes it's just a bad sprain, but you get the phalangeal fractures. Sometimes it rotates all the way down into the metacarpal, and they get
the little bones, the little finger bones.
The little finger bones that are, you could swallow them if you needed to. But they're the tiny finger bones, and it's pretty amazing what our hands can do. But the forces that they see when we're punching and grabbing and throwing people can exceed what they can handle sometimes. And
I've seen you wear these little gloves, and they kind of make you look like, I don't know, what is it, like Star Trek when the fingers separate?
It depends on the generation of the person. So the Spock hand, buddy taping. I'm a big believer in buddy taping.
So just taping, like putting 2 pieces of tape?
Yeah.
Always when you train? Gi, no gi?
Always buddy tape my fingers. Just it keeps any one finger from being isolated.
So do you tape underneath those gloves?
You don't need
one or the other?
This is just a convenience.
That is nice.
They're nice.
Put them on and off.
Just slide them on, throw them in the wash, and they hold up pretty good. So that's what I've been probably doing that for 7, 8 years even.
Has it caught on at all? Or does everybody just make fun of you?
No, at first people kind of like, I don't know about that. And then they hurt their finger.
And they're like,
oh, okay. And then, you could wear them after an injury, but it's best to wear them before.
Yep.
And then just as a hand surgeon, I'm just hyper aware of. So
like dislocating a finger or spraining something. And I've seen people at my gyms buddy tape the wrong fingers together, right? So they like sprain their middle finger and they put it to their ring, but then you're exposing your index and your small. Is that, have you seen anything?
You find, the gloves that I get, these Graps gloves, they do have a variation that will put the middle to the ring, but it kind of depends on what ligament was sprained, and it kind of depends on what you're doing. But just the middle to ring leaves the small and the index finger out flying around. Without a buddy. And without a buddy.
Without a buddy.
And for me, prevention, I want them to have buddies.
Yeah. Very cool. Yeah. What's the coolest injury you've ever treated? Combat athlete or not?
So I guess you probably know when we get into injuries, you've had those cases that just go great. Like, I nailed that. That bone came together perfect. Couldn't even see the fracture line. It was just beautiful. And those are great, but you kind of forget about them, or they blur together, and you remember either the ones that had a big or interesting story around it or didn't go well. I guess the ones that stick in my mind the most are I mean, just the traumas, the story behind it. And it's not necessarily combat sports, it's real world combat, knife fights and stuff like that, horrible stories of that kind of stuff that sink in and the story behind it, and you do what you can to put them together. But yeah, it's kind of a bummer that the good cases, the ones that go really well, just kind of like, yeah, all right, that's how it's supposed to go, and you don't remember it.
And it's the majority of them.
Yeah, and so it's unfortunately rare when one really sticks out. But at the same time, it'd be nice to reward ourselves with the ones that we did good, But I don't know. It's the nature of I guess, who we are, I guess, where you're going to remember the bad more than you remember the good.
Yeah.
Yeah.
What's the best one you've ever done?
Recency bias. The guy who, in a fight, breaks 2 metacarpals. And, it's pretty bad. Definitely needs surgery. And he's a boxer. And he wants to get back into things. He would like to fight in the next 2 months. You're like, all right, okay, Is
that reasonable?
I think it's reasonable.
Okay.
And by using the technique of putting these screws, these nails down the center of the bones, it's pretty quick surgery too. You don't have to screw in 6 different screws for each metacarpal, and that just takes extra time. And you can do it through these little tiny incisions over the knuckles. And so, the whole case takes a half hour, both bones fixed.
Nice.
Don't even have to put him in a cast afterwards. You let him move right away. And recently saw him back at 6 weeks, and fractures are healed. He's moving pretty well, and it's like, all right, you got 2 weeks to feel like your hand's strong. If you want to try to fight, I'm okay with it. You know. And so yeah, that's.
So he started punching. Did he go fight?
I will hear soon.
Oh, okay, so that was recent.
Yeah,
nice.
Yeah. I hope it all went well, but.
When would you let them start striking again?
Usually, if it's not a rush, ideally at 6 weeks, I'm okay with doing light pad work.
Nice.
The speed bag, maybe working with their trainer, doing light pads. Kind of at the 2 month mark, we can start doing something heavier as long as there's not pain. And then where there's unpredictable things with sparring and stuff like that, I try to get them to go full go at 12 weeks. But
so this was quick.
Obviously, it can be accelerated, and the bones can probably handle it at 8 weeks. Certainly, I think it's safe. But they may not have their strength or full range of motion yet, depending on how the rehab's going. But with that way of fixing it, you can get them moving right away and get them that much further down the road faster. So
cool, quicker than a lot of the surgeries I do, like ACLs and things.
Well, yeah, the ACL where
you can't speed it.
You cannot rush biology, as they say,
that's right.
And turning this tendon into a ligament and all the stuff that goes along with that just takes the body time.
Yeah.
And it can be frustrating for the patient and the surgeon before you're like, yeah, I know you feel good.
But we're not ready yet. Yep.
But.
What is the worst injury that you've had?
That I've personally had? My pec tore.
Yeah.
And that was almost a year and a half ago. And I had, 25 years of combat sports between wrestling and jiu-jitsu and MMA. And, there was definitely some scrapes and nicks and, maybe I'd partially torn my ACL at some point, but I got back to things. But this was the first time I had to go under the knife myself. And it was just a freak accident, rolling with a guy that we'd rolled together a bunch, and he was very good, and we were going after it, and I didn't want him to get behind me. Cow catcher kind of arm behind me, and pow, eccentrically loaded my pec, and
so you kind of like a turtle type position, and he was trying to spin?
Yeah, it was more of a scramble.
Yeah.
And, he had gone for a guillotine, and I spun out of it, and the way I was spinning out of it, he was going to try to get behind me. And so I got my arm out, and he was moving fast, and
just the pull.
Just the pull.
So big pop.
Yep, it popped. He stopped right away because he heard it, and I stopped right away because I felt it. And being a surgeon that fixes this problem, you kind of know right away, like, oh, that's what that feels like.
Did it hurt a lot?
There wasn't a lot of pain. It was something like, ow, okay. But then you start getting this cramping sensation. You're like, oh no. And you try to flex and it's just not working right. And you're just like, oh no. Yeah. And it was more of like the pride or the ego and all that kind of stuff. And knowing that there's going to be a rehab process and you just don't want to do that.
As a surgeon, you go through everything right as soon as it happens. You go through the whole process in your head.
And I know you've been through it yourself with surgeries, and you just kind of know immediately. Oh, well, this is what this means. I'm
out for a little bit.
I'm out for a while.
Yeah.
And it's frustrating. And what was particularly frustrating at that time is just jiu-jitsu had become, in hindsight, outsized in importance in life. I was training a lot. And, just a lot of stuff going on in life, but I was doing a lot of jiu-jitsu. I was feeling good with my jiu-jitsu. And I was even thinking about competing again. I was in great shape and not dealing with a lot of other things that I should have been dealing with in life. And so when my pec went, is immediately having to then encounter all of those things that I had been neglecting, which was also probably good in hindsight, but at the same time made it that much worse.
It seems like injuries come when you need a break from something. That's what I've noticed. It's like, oh, you needed to take a break. Like you needed to let your body heal a little bit.
There is something to be said about recovery. And I mean, we tell our patients, you got to rest. You got to give yourself time to recover. You got to do that stuff. But as surgeons, we're taught, if you stop moving, you're going to die. You're a shark. If you go. And we just embrace that in everything. And it's a lesson. You wish you didn't have to go through a big setback to learn it, but.
Was there a lot of regret when it happened? Like, I shouldn't have trained today. Oh, I was tired.
Yeah, there's those thoughts that have crossed your mind. And because I was thinking about competing again, I was starting to lift weights. I was debating which weight class I was going to be in. I was going to try to bulk up a little bit to fit the weight class a little bit better. And so I don't usually lift heavy before jiu-jitsu. And this time I had done some heavy deadlifts. And, maybe I was neuromuscularly fatigued and I just, my body didn't respond the way it usually would have. And you think about all these things. And of course, the people, my training partner who did it to me, of course, he's got regrets.
Yeah,
Could I have done something different?
Yeah.
And the person who paired us up, because it wasn't the plan to go hard at that moment, but the guy paired us up and he's like, I shouldn't have done that, So everyone feels bad about it.
That's how injuries are. And every injury I've had, it's like regret.
Right.
Immediate. And I've had injuries from not tapping. So that's a much deeper type of regret because it's really my fault, right? And so when those happen, it's like, man, and you have to learn that way. Like an ACL tear, and then you're almost a year out of the sport because you had to learn a lesson because you didn't tap, right?
The not tapping is a thing, but it's interesting. You're in the thick of it. You know the technique. You know you're technically in trouble, but you're in competition. You don't want to lose.
Adrenaline. You don't feel it.
Yeah, with footlocks, you especially, that's always the danger is you just don't feel it until it's too late. And it's a lesson I'm sure we both wish we didn't have to learn, but
a lot of people do, right? Like I treated somebody for a UCL, like the Tommy John elbow procedure recently, and he's a special forces guy. And I said, "How'd you do it?" And I said, "Let me guess. You train jiu-jitsu, don't you?" He's like, "Arm bar in competition." And I've had like 3 of them ever since, and they're all in the military, and just nobody wants to tap. One of my financial advisors, rotator cuff tear. He's like 60 or like 50 years old. And he's like, I was showing my kids I could be tough in like a naga. And he's like, I didn't tap. His arms were behind his back. Rotator cuff tear. Never went back to jiu-jitsu.
That's where it's a bummer if you never get back. But it is funny, this inherent thing, and I talked about kind of the primal satisfaction I was getting from wrestling. And there is something I think in all of us where a 50-year-old accountant is willing to get hurt over a $10 medal. It's
and you're paying to get hurt.
You're paying to participate in that tournament, and you might get this medal that is not worth as much as you spent to register. But there is just something in us, I think, and combat sports is an outlet for that. And you think about like, oh man, if I hadn't been doing jiu-jitsu, I wouldn't have torn my pec, or maybe my knee wouldn't hurt. But at the same time, I think of all the stuff that I have done and I've learned about myself and the people I've met, and just who I am is because I've done these things, and it's worth it. It's totally worth it. So that pec tear, all right, bummer.
Lessons learned.
but I'm back into it. I learned I could come back from it. That was an obstacle I had never had to overcome before. I had never had to come back from a surgery.
Well, I bet you also treat patients differently now for that injury in particular.
There is, yes. I have so much respect for the people who can come back and reach the level they were at before and continue doing it, because it is really hard to do the rehab and come back. And then, my injury is not nearly an ACL. Those are...
pec's tough too. I recently tore my biceps and I had surgery for that, but it's been smooth. Like the surgery barely hurt. I kind of wish it hurt because now I'm like, because I'm like, it doesn't really hurt. Let's go Peloton like a maniac. Let's go lift the left arm. And then I try to lift heavy on the other side. And your right side, when you lift on the left, the right side starts contracting. And I'm like, oh, you got to settle it down, right? But now I see my patients who had the procedure I had, which is putting the biceps back to the bone, and they're crying. And like I had one of my Army guys come in. I was 2 days out of surgery seeing patients. He was 3 weeks out. He's like, Doc, it hurts. I literally looked at him and I said, grow a pair. I said,
there's that too. So while I have that much more respect for the people who get through it and return to all the things that are doing it before, I now have a harder time on those patients that don't make the recovery that you would expect. And I guess, could I have done something different about their surgery? But at the same time, it's a surgery you do perhaps hundreds of times. You know how people are supposed to go, and this particular patient doesn't do it.
Why? And why?
And it's, so I didn't use pain medication, Tylenol and naproxen.
Yeah.
And if it wasn't Thanksgiving right after my surgery, I would have been back to work like 2 days later. And then these people who have a surgery that's really not that big of a deal, and it's still 3 months later, and they don't want to go back to work. And it's like, well, this isn't on me. This is you.
Yeah.
And that's that much harder for me too.
I'll tell you, the shoulder versus knee thing, everybody's asking me, like, how does it compare to an ACL? And granted, it wasn't a rotator cuff, which rotator cuffs, when I see my patients, it looks miserable. Like people get stiff. Yeah. It seems very painful. This is nothing near that, but I don't wish an ACL like on my worst enemy. Not that I think I have enemies, but the recovery for a knee surgery is more mentally draining than physical. And the amount of recovery you have, like a rehab you have to put into it, it's like a daily thing. And you're on crutches and you're swelling. The shoulder doesn't swell as much. No. You could still walk. We were saying you could still walk around and do everything. But the knee is a different beast. Getting the motion back in that thing and just the mental aspect is the hardest part. Like you're crying, you're depressed because you're not doing what you want to do. And it's another year, right? So
it's hard. And the mental side, and kind of certainly as orthopedic surgeons, we put things back together and go.
Go do rehab. All that matters is PT.
Do the PT, but there is a huge mental component to it, and you can probably sense that patient comes in before surgery and they're just so anxious. You kind of already know, like, oh man, they're going to need a lot of hand holding. Therapy is going to have to work that much harder just to get them to start moving. This is going to be a longer road for them. Whereas, then you see combat sports athlete who's motivated. And you might go, okay, look, you're going to have to take it easy. You cannot do certain things for however long you're going to say. And it's interesting how you have to factor these things in. And it's the mentality, the mental side of these patients that you really have to factor in.
I've noticed a lot of the younger females, like maybe high school volleyball, high school basketball, and males too, like these young kids, they really struggle. A lot of them mentally, because like all their friends are doing things and hanging out, and then they're so nervous about re-injury. And I think everyone's nervous about re-injury. Maybe not some of the combat athletes. They're like, let's go. And I talked to Paige Yvette a little earlier today, and she's on the podcast too. And she was just like, I was committed to get back at 6 months. She's like, I went on Google and I saw people getting back at 6 months. And I was like, how'd that work out for you? And she's just like, yeah, there's no way. Like, there's just not. And she had really good coaches, like J-Flow telling her, you're not allowed here until 9 months. Okay. And, time, in my opinion, and I think a lot of PTs have said, the time is a soft recommendation, right? After a surgery, I say the earliest is 9 months, but really at an ACL, you're a year, right? Like maybe 9 months, you're back to doing things, but you're still nervous and you're still easing in. And like, you're not going to or you should not be competing at 9 months, right? Like very, very rare situations.
Very rare. Exceptionally rare.
Yeah.
Even to return to professional sports, a year, being 100% at a year is
for an ACL,
extremely hard to do. And unfortunately, there's stuff out there on the internet that perhaps convinces people that it can happen sooner. And that's a battle to fight too.
Because some people do go back and get lucky.
Right. Yeah.
So of course there's like that one outlier, right?
Yeah, the one outlier who, for who knows what reason, did extremely well. Maybe it's their genes, maybe they just got lucky, maybe there's something else going on.
My favorite is smoking. Like when people smoke and they're like, yeah, my grandma smoked till she was 90. Like she lived forever. I was like, that is the outlier, guys.
Yes. It's clear that smoking is not good for you. It shortens your life. Yeah. Maybe your grandma would have made it to 105.
Yeah, maybe.
But, so yeah, just the information that's out there. There's so much information that's out there. And we have to embrace that that's how people are going to get their information. And, instead of, the respect for experts perhaps being diminished, perhaps people are going to get they're going to get their information. They're going to do their own research, and that's fine. But having to balance kind of what the expectations are because they're doing that and what is the truth. And it's a new dynamic of having to balance those things.
And that's also kind of why I started this podcast, right? I was an orthopedic surgeon and I trained jiu-jitsu. I'm having you here, orthopedic surgeon, train jiu-jitsu, and it's such a different thing to have a doctor who's in the sport, knows what you want to get back to. We kind of know what you can get back to. Mm-hmm. So I think it's a really cool dynamic. If I did gymnastics, I'd be like, I'm going to find a surgeon that does gymnastics, right?
Yeah.
Because then as you're recovering, what can I do?
Right.
Right. Like my patients are like, what can I do? I'm like, all right, you had an ACL. Let's not do like reverse delahiva right now. Maybe not delahiva right now. Maybe we start on top. Let's not wrestle. And maybe another orthopedic surgeon would be like, you can go light, but everybody knows what that means in the jiu-jitsu gym. Like you have that partner where you start light and then everybody escalates and all of a sudden you're having a full on match and everybody's bleeding. So I think forums like this and like your YouTube channel is awesome because it just breaks things down nicely. Cut to the bone, so it breaks things down nicely, and you just give it like a doctor, but also like an athlete, and it's awesome, and I think it helps athletes get information.
Yes,
simple.
Being able to understand the forces that are going to be going through their body, and that so many people get turned off by their surgeon when the surgeon tells them, "Well, just don't do that anymore."
Right. I think I posted something about that recently. That was like,
that's not an option for these people. It for whatever reason, and it kind of happened with me. Jiu-jitsu becomes really important for various reasons. It's this outlet of energy. It's this pursuit of mastery. It's being around friends. It's exercise. It makes you feel good. The community, social interaction, all these things that it becomes for you, and then just to like tell someone no. You shouldn't do that anymore.
I've had a lot of people come to me like that. Other sports too. They're like, my doctor told me I shouldn't do this. And I was like, well, do you want to do this? I think I've only told one person, and it wasn't even me that told them, that they couldn't do football anymore. And it was because they had like congenital, so like they were from birth, narrowing of their cervical spine, their spinal cord, I'm not a spine surgeon, but their spinal cord was narrowed and I caught it. Because they were having numbness, tingling, and they thought it was just constant stingers.
Right.
So I ordered all the imaging, and I just looked at it, and my heart sank. This is a 17-year-old kid that loves football. Yeah. And I had to be like, listen, I'm going to have you talk to the neurosurgeon about it. And that was the only person I think I've ever told, so far.
Along the discussion of life and limb, paralysis is no joke.
Correct.
And so, that is certainly a time where you might have to have a talk with someone. But
otherwise, there's ways around things, right? The 80-year-old runner that wants to keep running, but their knees are killing them, and they're like, maybe you should stop doing that. You stop that and you die. Like that's how I look at it.
Right.
I'd rather you have that than be obese with a heart attack, right? I'd rather you, and we can help you with the knee pain and get you doing what makes you happy.
Right. Yes, and that's the cool thing about orthopedics is we really do have the chance, and it's that much better if we understand what the patient is going through and their mindset and how important certain things are to them. And then the community, we were kind of friends on Instagram, but now we've gotten to know each other, and it's kind of cool. I mean,
because we're at that awesome course, the UFC sports medicine course,
combat sports medicine course, and like-minded surgeons kind of talking about how to treat these athletes because they are unique.
Awesome. Well, let's close out with one more question. What tip can you give to athletes? Actually, two questions. What tips can you give to athletes maybe younger that are competing that want to have a long career versus just going hard in the paint and getting injured and then being like 25 and not being able to go at the capacity they want to for longer? And then the second question would be, what would you tell like the 35, 45, like even like the 40s, I would say, 40-year-old athlete that still wants to get in there, but isn't like myself, right? I get in there and I'm nervous because I keep getting injured. And it's like, how do we prevent that?
Yeah. So starting with the young person, learning to rest and recover and being tough and fighting through an injury is not always the best thing. And if your goal is longevity, then you've got to give your body a chance. And it's funny, we see these 20-year-olds so strong and so muscular and so athletic, but then they go out and party and they're not getting sleep and they're not getting great nutrition, but they can make up for it because they're 20.
We talked about that earlier. I was like, when I was 20, man, if I wish I did what I do now when I was 20.
But it does add up. And, at that combat sports medicine thing, that was the question I asked Chuck Liddell. It's kind of like, what could 50-year-old Chuck tell the 20-year-old Chuck? He's like, I learned how to recover.
And what is recovery to you? Like, what are the big things?
Big things. Getting into lifestyle medicine.
Oh, that's right. We're going to ask about that. We'll do another podcast
So
sometime.
I think sleep is crucial, and us surgeons are bad at it because we train to think that sleep is a weakness and I can get by with 4 hours of sleep, whatever, that's fine.
Sometimes you had to, right? Or sometimes you get woken up by an attending yelling at you. Why'd you do this yesterday?
Yeah. It's part of the job.
Stressful.
But at the same time, you think like, well, this is what I do. And so even when I can sleep more, I'm still going to just do the 4 hours. I'm going to go out and party tonight, even though I'm not working. And because I'm not working, I'm going to go party and still get that 4 hours and I'm good to go. But sleep is so crucial to everything, our brain learning, our body's recovering. So sleep, prioritizing.
What is it, like 7 to 9 hours?
For the average adult, yes, 7 to 9 hours. And it was a battle for me on my own to figure out how to get to 7 hours.
It's hard.
It's really hard. And it's taken some changes in what I do.
Especially when you train at night. Because I train at night.
Yeah.
Because I'm up early for work.
Your sympathetic system's that much more revved up, and it's that much harder to settle down. And then maybe you sit in front of the TV, and then you got that stimulation going, and soon it's 11, but you got to get up at 5, and 6 hours, whatever. I can live on 6 hours. So yes, learning how to prioritize sleep and optimizing that, crucial. And then nutrition. When you're young, you think you can eat anything, and often you can eat anything and still look good, feel good, but it does add up. And we know the people who are in their 20s getting type 2 diabetes. What used to be old person fat disease is becoming a youth disease. And that adds up quickly over time and can be devastating to recovery and all the other organ systems of survival. So nutrition, and I'm not going to get into what diet is best. That's just...
I think that's so dependent on the person. I don't think there's one.
There is no one diet. No. I totally agree with that.
And understanding your body and knowing what, like when I go to restaurants, I'm like, no broccoli, no cauliflower, no mushrooms. I know, like, if it looks like it's trying to hurt me and it's a vegetable, and they laugh, I'm like, stay away. Yeah. So, but it's knowing your body and knowing how you're going to feel when you eat something. And, there's some diets out there that the all meat diets, I can say with confidence, are probably not the healthiest diet. But I have no problem with someone wanting to get their protein from meats. It's an efficient source of protein, and protein is crucial for rebuilding the tissues that have broken down from hard workouts. So and it's funny you talk about the meat thing. I know I was supposed to end the podcast, but the meat thing. So I have to get my functional medicine doctor on here at one point because we went full carnivore for a little short term, and I really did learn about the anti-inflammatory effects of it, and it cured all my gut issues. Okay. But it was temporary. Yeah. And it's not really sustainable. No. But my body was operating on fats. And I was strong. I was sleeping like 9 hours. Okay. And I was also tired because my body was learning to adapt with different fuel. And then once I went back to like adding carbs and like honey and fruit, then I felt like I felt really good again.
Yeah.
But I felt great once my body switched over. But that's a whole other conversation.
No.
It's super interesting, like all these things.
Interesting how, I mean, when you're paying attention, diet clearly influences how we feel and should not neglect it. So yeah, I would say the biggest things about recovery are sleep, rest, and nutrition that unfortunately when you're young you neglect. And then to talk about the older person, you know, maybe they got a job now and they got a family, but they want to get into it. Maybe their kids started doing jiu-jitsu and they're looking across, and maybe I'll do the adult class while my kids doing the kids class.
And just to clarify, 40 is not old. It's just that in jiu-jitsu where you're really like putting a lot of strain on your body, it's not super young anymore.
No, it's definitely not.
It's not old. It's not old.
It's definitely not. I hope to be doing jiu-jitsu because of longevity when I'm 70 or 80 if I make it that long.
I said I want to die in my gi or with a belt on.
Yeah, so with those goals of doing this for 4 more decades, I think the biggest thing, along with learning how to rest and eat right, hopefully you've learned that as you've gotten older, but not having an ego. And that's the lesson I'm really, well, I guess I could say I've learned it a little bit more recently, but you're going against the 20-year-old who's got you in a Kimura, tap.
Yep.
You don't need to tear your rotator cuff. You don't need that $10 medal. No one's going to care. But you got to work. You got to pick up your kids. And no one cares if you tap, especially in practice, because that's when everyone's trying to get better anyways. So
it's a hard one. I'm learning it still.
Yeah.
Because you talk about it and you're like, yeah, I don't have an ego. And then you get in the situation, the adrenaline's going, and it's a kid, and their parents are watching, and your coach is yelling at you.
It's true. In those situations, it can be hard.
And it sounds ridiculous when I say it, but that's like all the stuff that's happening.
Yeah.
You know?
No, all those things, all those influences, and you want to do your best, and you don't want to give up, and giving up is the worst thing. But if you're an accountant without a rotator cuff, that's also a huge bummer. And
I mean, if you're competing in your chariot because you had too much of an ego to tap during training.
Oh gosh, yeah, right. Missing out on competition because you had too big of an ego in competition or in practice.
Yeah, I mean, competition is bad too, but there's way more adrenaline in that situation.
Yeah. So ego is the enemy, as they say, as far as longevity is concerned. And I think a lot of us, as we transition from our younger competitive days to wanting to keep it in our lives, especially when we've got our jobs as surgeons, is swallowing that ego and tapping a little bit more often. And realizing, you got limitations, and giving your body a chance to rest, and you can do it. Yeah, I plan on doing it for a long time.
And I mean, I've also learned that the awareness before is important. So when I tore my ACL not tapping, I was like, oh my gosh, I didn't even feel that. I wasn't even aware it was happening during it, right? So I was like, I'm gonna win. Like, you're just not. So actually, one of my friends, Lauren Sears, taught me that. She's like, I go into these matches and I think, listen, I want to compete. I want to train tomorrow or the next day or whatever. And so I need to be aware of these positions and know when I need to tap. And so I think since that injury, I've created that more awareness of like, even if it's a weird position that it's not really a hold or it's not a submission and I feel uncomfortable, I tap and my partner's like, what? I'm like, my arm was just not in a place I wanted it to be in. That awareness.
Yeah, body. One of the skills you can get from jiu-jitsu, body awareness and that kind of stuff. Learning how you move and how you feel is crucial, and also not only being aware but being able to act on it.
Correct.
And
So like telling yourself beforehand, like before a competition, I'm like, listen, I'd have a talk with myself. If you're in a compromising position, you need to tap. And I know that's not probably people say, oh, that's terrible. You're going in ready to lose. I'm like, no, I'm going in ready if I need to, and they get the better of me and they win. It's a game of chess, right? That's a checkmate. And let's call it, right? Instead of letting it go to the end where they tip the king and I get injured again. Well, thanks for coming. Thank you for being on my podcast. Want to do it again?
Yeah, for sure.
Where can people find you?
Well, I practice here in San Diego, beautiful San Diego. You can make a vacation out of your visiting me.
Hopefully not for
hopefully you're not really hurt, and but I can help you if you are. And then Cut to the Bone, the YouTube channel, combining combat sports and orthopedic surgery, and then the social media, LinkedIn and Instagram and all that kind of stuff I'm trying to put out there that hopefully educate and
I don't think there's two of
inspire.
you. Lucius Pomerantz.
Lucius Pomerantz, I'm probably the only person with that name.
I think so.
Yeah.
All right, well, thanks again.
Thank you.
An Ironic Media production. Visit us at ironickmedia.com.